Hello, this presentation is on the mental health disorders of bipolar and schizophrenia. All content and information in this video is for informational and educational purposes only, does not represent the views of OUHCOM, and does not establish any kind of educational mentor-client relationship. The content of this presentation may be emotionally challenging as it discusses sensitive topics surrounding mental health. If at any point a break is needed, please take one and be sure to use the resources provided as needed. What is bipolar? It is a mental health condition in which there are unusual shifts in a person's mood. The episodes of extreme sadness and happiness can be rare or can happen multiple times a year. Before we move on, here are some definitions that may be helpful. Mania is an extremely elevated, excitable, or irritable mood with abnormally increased energy level. There may be a decreased need for sleep, increased self-esteem, and racing thoughts. Hypomania is a less severe form of mania. There are several different types of bipolar disorders: bipolar 1, bipolar 2, and cyclothymia. In bipolar 1, a person experiences a mix of manic episodes and hypomanic or major depressive episodes. In bipolar 2, a person experiences a mix of hypomanic episodes and major depressive episodes. They do not have any manic episodes, only hypomanic. In cyclothymia, there are many periods of hypomania and depression. Here is a visual of the different types of bipolar disorders. You can see how the orange line of bipolar 1 cycles all the way from mania down to major depression, and the green line of bipolar 2 cycles from major depression only up to hypomania. Cyclothymia is the purple line, and it just cycles between hypomania and minor depression. Treatment for bipolar disorders includes psychotherapy, which is also known as talk therapy. It aims to help identify and change troubling emotions, thoughts, and behaviors. Medications are also an option. There are several different medications available. Other options include regular exercise and tracking moods and activities. Check-in. What type of bipolar disorder would it be if someone experiences episodes of major depression and hypomania? A. Cyclothymia, B. Bipolar 1, C. Bipolar 2, or D. None of the above? The answer is bipolar 2. Remember that bipolar 1 has manic episodes, which is much more severe than hypomania, and cyclothymia does not have major depressive episodes, only minor depressions. Cyclothymia mood changes also occur much more frequently, cycling through many episodes of hypomania and minor depression. Here is that chart that we saw earlier to remind you. Now we will shift into talking about schizophrenia. What is schizophrenia? It is a mental health condition that affects how a person thinks, feels, and behaves. An individual may experience delusions, hallucinations, disorganized speech, extremely disorganized behavior, or other negative symptoms. Let's define some of these symptoms. Delusions are when someone believes something that is false. For example, believing you have a superpower. Hallucinations are when someone senses something that is not real. For example, hearing voices that are not there. Disorganized speech is when someone shifts topics quickly, responds with unrelated answers, or is saying things that do not make sense to others. Extremely disorganized behaviors are when someone is acting unpredictably or odd. This can range from childlike silliness to unreasonable agitation. For example, laughing or smiling at an inappropriate time. Other negative symptoms would include things like not doing personal hygiene, appearing to lack emotions, or not socializing. Other negative symptoms does not necessarily mean bad symptoms. Providers use the term negative symptoms to refer to symptoms that are a reduction or absence of normal behaviors. For example, lack of emotion, decreased motivation, or not speaking. On the other hand, positive symptoms is a term used to describe symptoms that are adding to or exaggerating someone's behaviors, thoughts, or feelings. For example, delusions, hallucinations, or repetitive movements. Schizophrenia treatment is available. Psychosocial treatment includes things such as talk therapy, behavioral therapy, and behavioral skills training. Several different medications are available, and other options include education and support from family and friends, and coordinated care with healthcare providers, family friends, case management, and employment support. Check-in. Which of the following could be a possible symptom of schizophrenia? A. Disorganized speech, B. Delusions, C. Neglecting hygiene, or D. All of the above? The answer is D. All of the above. These are all possible symptoms of schizophrenia. Listed here are national resources anyone is able to utilize to seek out help for their mental health. Thank you for watching this presentation.